Hello, my name is Professor Sean Taylor. I'm a Dawarra man from the eastern part of the Torres Strait region in Queensland, and I'm also the Professor of Aboriginal and Torres Strait Islander Health and Director of ANEMDA at the University of Melbourne. So if I had to choose one word to describe my hopes for the 18th World Congress, what would it be and why? It would be translation. And the reason being is I want to see a lot of research that has been conducted translate to meaningful outcomes that improve health outcomes for everyone. And also looking at how research translates into policy, looking at what change we can make, how research can inform policy, and how does policy change health service delivery? Or how does it change funding models that help the implementations of policy frameworks or even clinical services that can improve public health initiatives that is informed by research? I come from the eastern part of the Torres Strait where we speak Meriamil, and especially in the greater northern Australia, where a lot of Aboriginal and Torres Strait Islanders communities speak their native tongue. This is imperative for us. And I think that's a global concept because if people are able to consent in their own language, people are able to make informed decisions and able to communicate effectively, which will improve health outcomes for those who don't speak English as a first language, which we know English dominates, especially in Australia, whereas English is the recommended language, but there's a high proportion of Aboriginal and Torres Strait Islanders who don't speak English as a first language. One of the things that I fully support in public health is, again, translation. Translation of research that makes a difference, and also making meaningful research that translates into health practices, clinical service delivery to improve the wider population and ensuring that the interventions that we are working towards meets the needs of the people that we are working with. And we need to co-design, we need to ensure that it doesn't just meet the researchers' needs or the clinicians' needs, but meets the community needs and the consumer needs to ensure it is beneficial to all those who are working in the area of the public health issue.